Welcome to the podcast first part in our education series on type 2 diabetes. In this opening session, I want to set the scene by really understanding the condition itself. Too often, diabetes gets reduced to a number on a lab slip, a raised HbA1c, but in truth, it is one of the most complex cardiometabolic disorders we manage in primary care. At the macro level, the drivers are easy to recognize. We live in an obesogenic environment. Diets are calorie rich and nutrient poor. Sedentary lifestyles have become the norm with long hours at desks and minimal movement. Rapid urbanization and economic development have created communities where it is easier to eat processed food and sit still than it is to cook fresh meals or walk. These environmental factors put the population at risk long before we ever measure a single blood sugar. At the micro level, the dysfunction runs through almost every organ system. Insulin resistance develops in the liver, skeletal muscle, and adipose tissue, meaning that glucose is no longer taken up efficiently. The pancreatic beta cells begin to fail. They decline in both mass and function, reducing insulin secretion. At the same time, the alpha cells go into overdrive, producing excess glucagon, which pushes hepatic glucose production even higher. Within the pancreatic islets, amyloid peptide deposits build up and contribute to beta cell destruction. The gut is also involved. Patients develop abnormalities in gastric emptying, increased glucose absorption, and disruption of the gut microbiota. The incretin hormones, which normally help to boost insulin and suppress glucagon, lose much of their effect. The kidneys then worsen the picture, reabsorbing more glucose through SGLT2 pathways. The brain is far from passive in this process. There are changes in appetite regulation, an increase in sympathetic tone, and reduced dopamine activity, all of which encourage overeating and weight gain. Overlaying this is a background of chronic inflammation and immune dysfunction, which drives vascular damage and accelerates complications. So, diabetes is not just high blood sugar. It is a multisystem condition touching the pancreas, the liver, the gut, the kidneys, the brain, the immune system, and the vasculature. It is the combination of environment and biology, lifestyle and physiology, all converging in a way that makes it one of the defining health challenges of our time. When you see your next patient with type 2 diabetes, remember you are looking at much more than HbA1c. You are seeing the end result of a complex interaction between environment, lifestyle, and multi-organ dysfunction. Recognizing that bigger picture is the first step in managing the condition with empathy, precision, and effectiveness. In our next episode, we will move from understanding the condition to discussing lifestyle interventions. We'll look at weight, nutrition, activity, and sleep, and how these foundations can change the trajectory of diabetes for our patients.